Good afternoon, everybody. My name is Steve Cummins, and I'm talking to you today on behalf of our wider TfL study team to tell you about our evaluation of the implementation of advertising restrictions on high-fat salt and sugar products on the Transport for London estate. So just to give you some background, the advertisement of high-fat salt and sugar foods and drinks is a key driver of unhealthy food purchasing. In February 2019, the Mayor of London introduced restrictions on the outdoor advertisement of HFSS products across the TfL estate as part of a wider set of policy tools to help combat childhood obesity. The TfL estate accounts for around about 40% of all outdoor advertising in London, so the policy had the effect of significantly reducing population exposure to unhealthy food advertising. It also provided an excellent opportunity to evaluate both impact and implementation of this policy and generate some real-world effectiveness evidence for healthier advertising policies for policy. As I mentioned earlier, individual food and beverage products were targeted for this policy. So adverts with food and beverage products were submitted to TfL and then assessed against the DHSC nutrient profile model. Under this model, which classifies individual food and drinks products as HFSS or not, products were classed as HFSS if they scored greater than 4 for foods or greater than 1 for beverages. As a result, these products could not be advertised if they met that threshold. So this means that sugar-sweetened beverages, for example, could not be advertised, but it does mean their policy compliant alternatives, such as low or very reduced calorie versions of the same drink, could be advertised alongside their brands. However, for certain products like chocolate confectionery, where there are no alternates, this meant that both the product and the brand also was removed from the TfL estate. The MPM does generate some anomalies, such as the advertisement of fried chicken, for example. So fried chicken has a great deal of protein in it, which garners some positive points under the MPM model. So this meant it was policy compliant, despite the fact that you and I would probably popularly consider fried chicken to be an HFSS product. Where an advertiser believes a product advertisement does not contribute to childhood obesity or HFSS consumption by children, an application could be made to a so-called exceptions panel where that product was discussed, and then a decision would be made about whether that product could continue to be advertised. And some products were allowed to do that, such as stock cubes and olive oil, which we can reasonably say that did not contribute to childhood obesity. So just some examples here. There are some adverts taken from the TfL estate pre-intervention. And so which of these were then removed from the TfL estate as a result of the policy? So we can see here that the product advertisement for individual food and individual chocolate and confectionery products was removed. We can see brand advertising for chocolate and confectionery was removed, and we see advertising for the burger was removed. However, the fried chicken advert for the delivery aggregator was still present, as was an advert for salad with the delivery aggregator, as well as a meal box company here, which had a relatively healthy meal as a result of the advertising. So there are two main questions for today. What is the impact of the TfL policy on household HFSS food purchasing? And what are the main considerations when implementing the policy for implementers? I'm going to focus mainly on headline evaluation findings. I am happy to answer methods questions at the end, or perhaps I can supply the published scientific papers for you to read later. So first up, we're going to look at the impact on household purchases of HFSS grocery products. And I'm focusing here on grocery products because this is the main tool for our evaluation. So we used a controlled design here where we compared the effect of the policy in the intervention area, which is London, and compared it with a counterfactual which generated from a control area, which was the north of England. So at 10 months, over the course of the study period, which was 80 weeks, around 5.1 million foods and drinks were purchased, which of around 2 million of those were HFSS purchases, so around about 40%. And we had data from just under 2,000 households, which equated to purchasing products purchased for just over 5,000 people. So at 10 months post-implementation, there was a 6.7% relative reduction in total weekly household purchases of energy from HFSS products. So this equated to an average reduction of 1,000 calories per household per week. And this also meant there were reductions in fat purchases, 57.9 grams, saturated fat purchases of 26.4 grams, and sugar purchases of just under 81 grams. So you can see here the policy has had a relatively large effect. We also looked at the impact on 5 key food and drink product categories. I'm just going to talk to you briefly about one of those. So our largest falls were observed for chocolate and confectionery, with a near 20% relative reduction in total household weekly energy purchases as a result of the policy. So this equates to about 318 calories from chocolate and confectionery per household per week, which meant there were reductions in fat, saturated fat, and nearly 42 grams of sugar. Just to say that we did look at other product categories, as I mentioned, and we found no impacts on sugary drinks, and we found no impact on sugary cereals, and marginal impacts on other product categories. I'll explain a bit why that might be at the end. So as I said, we're also interested in implementation challenges, and we focused on 2 main sets of implementation challenges, both practical, which I'm going to talk about here, and political, which will be in the next slide. So when it comes to practical considerations, 2 key things emerged. One, which is engagement with industry. Engaging early with industry is really key to policy success. But it's fair to say there could have been more time between announcement of the policy and its implementation, which was just around about 3 months in the case of this policy. And the communication of any kind of subtle policy changes could be improved, as was the case here. However, it's fair to say that industry very quickly adjusted the policy and it became highly routinized in practice. So policy was very quick to adapt to the policy and it didn't really become a problem. So use of the exceptions panel also became relatively low. Only a few products were really assessed by this panel over time, and very few of those were granted an exception. The other key issue here is defining junk food. So as I already alluded to earlier, there are strong limitations of the nutrient profile model. It doesn't allow certain products which we would popularly consider to be HFSS, such as fried chicken. They are deemed to be policy compliant. It doesn't account for things like portion sizes. So you could, for example, advertise a bucket of chicken and that would be okay. And also it doesn't really counter for fake foods. So things like polystyrene burgers, which were then used as models in the advertisement of certain types of products. So just to say that I think there was a key issue here about independent traders. So it can be quite costly for companies to develop the nutrient information for each individual product to be assessed by TfL. And so independent traders, such as kind of independent curry houses or fish and chip shops, might not have the capacity or the resource to generate nutrient profiles for their own products. So we need to think carefully about how we treat those traders. The exceptions process, which I mentioned earlier, really did facilitate implementation, though it was seen by some to run the risk of undermining the nutrient profile model. And there were particular challenges for food delivery platforms and kind of model foods, as I just mentioned. And the consistent application of policy is key. There are also political considerations when it comes to implementation. There needs to be maintained the public perception this is common sense policy, and it's a really important concern for policymakers. And it must pass the so-called reasonableness test to avoid any kind of public backlash. So public perceptions of the policy and efforts to maintain public support were an important concern for the Mayor in this policy. And there was definitely a tension between public health and protecting commercial revenue. There's a keen interest in monitoring any financial impact of the policy on advertising revenue for TfL. Industry did express some frustrations with the perceived influence of political motivations on policy, and implements did have some concerns about science being overshadowed or weakened due to lobbying. And there's also, I think, fair to say, navigation of reputational concerns. So would there be a public backlash, negative press, particularly around the time of re-elections? Would there be tensions with this policy between local policy and then what the national government wants to do? So overall, I've got a couple of key messages that come out of this study. So the policy reduced average household weekly purchases of energy by just over 1,000 calories per household per week. In this study, this equates to reductions of purchased energy of just over 385 calories per person per week. For products with policy compliant alternatives, such as low or zero calorie drinks, brand advertising continued, and this might explain why we observed no impact on SSBs, and so indicates the importance of restrictions on brand as well as product advertising and optimising policy effectiveness. There's one big caveat here, that there are secular increases in HFSS purchases over time in our study sample, which meant the intervention was effective in reducing growth of HFSS purchases, but did not reduce absolute HFSS purchases. So key messages too around about implementation. So development, design and implementation of the policy was influenced by both practical and political factors, including the definitions of junk food and engagement with industry, and navigating putative impacts on revenue and supporting business. And also there was the issue of maintaining reputation and the political tensions. So in conclusion, restricting the outdoor advertisement of HFSS products is effective in reducing purchase of energy and nutrients from HFSS products. And in context, our findings show that the observed effects here are larger than that for the UK sugary drinks industry levy for sugar reduction, which is widely considered to be a very successful policy. Benefits are more likely to accrue to more disadvantaged households, potentially. I've not reported that data here, but that's true, and therefore may help reduce health inequalities. And that implementation study suggests policy is highly feasible and can be successfully delivered by local government. Our supporting evidence is all published and open access, and I just want to thank the School of Public Health Research for funding this and the wider study team. I'll take any questions. Thank you.